welcome to all our Physio TV viewers. I, Dr. Parheen Patel, Assistant Professor at Sancheti Institute for Orthopaedics and Rehabilitation, College of Physiotherapy, give you a warm welcome. Today with us, we have Dr. Aditi Ketkar, who is an master's from Manipal University and is currently working as an assistant professor in DAS Brijlal Jindal College of Physiotherapy, Pune. It's an honor to have you, ma'am. Handing over to you.
Hi, Fareen. Thank you for such a warm welcome. I hope this lecture helps in understanding some basic concepts of aerobic exercise and you all find it useful. So today we'll be discussing about some basic concepts of aerobic exercise. So starting with the definition of aerobic exercise. So aerobic exercise, basically it is the training that improves efficiency of the aerobic energy producing systems and can thereby help to improve the cardiorespiratory endurance. So it is the augmentation or facilitation of the energy utilization of the muscle by means of an exercise program. So ACSM defines it as any activity that uses large muscle groups and it can be maintained continuously and is rhythmic in nature. So exercise that use basically large muscle groups is continuous in nature and rhythmic is what defines the aerobic exercise. So improvement in the cardiovascular endurance will occur as a result of increased levels of oxidative enzymes in the muscle with the training substantially, increase in the mitochondrial density and size, thereby increasing the energy production, and increase in the muscle fiber capillary supply. So before we go on to the concepts of aerobic exercise, let us just look at some generally used terms or some definitions. Fitness, it is a general term that is used to describe ability to perform physical activity. Now, performing physical work is going to require cardiorespiratory system, muscle strength, endurance, and musculoskeletal flexibility, along with the proper neural control of all. So fitness is going to encompass all the systems working in synchrony. Endurance, it is the ability to work for prolonged periods of time and basically the ability to resist fatigue. Okay, so we have two types of endurance, muscular endurance and the cardiovascular endurance. Muscular endurance is the ability of a specific or an isolated muscle group to perform repeated contractions over a period of time. That is basically to resist fatigue. And cardiovascular endurance is the ability to perform large muscle dynamic exercises for a long period of amount of time. For example, swimming, cycling, walking, and so on. So you require a proper interplay of both cardiovascular endurance as well as muscular endurance in order to sustain activity for a longer period of time. Next is maximum oxygen consumption. So it is basically the measure of body's capacity to utilize oxygen. It is the maximum amount of oxygen which is consumed per minute when the individual has reached the maximum effort. So in an attempt of maximum effort, the maximum amount of oxygen that is consumed is called as maximum oxygen consumption. Now let's come back to the aerobic exercises. Before we understand the importance of aerobic exercises, let's first understand the energy systems. Okay, so this is just a brief introduction to the energy systems. So we all know ATP is the only energy source for all bodily functions and activities. So whenever ATP is used, it is must that it is replenished again. So it can be replenished by both aerobic system as well as the anaerobic system. So we have one aerobic and two anaerobic energy producing systems, which in turn will work to replenish the ATP reserve. So the first is ATP-PC or the alactic system. So ATP and creatine phosphate are present in very small amount in the muscle cells. So they can help to provide immediate or rapid energy supply. But because of this, because they are able to produce rapid and immediate energy supply, the O2 requirement is nil. Okay, so O2 is not required in order to produce energy when you talk about this system. And also one important concept over here is there is no lactic acid produced in this process. Okay, so that is why it is termed as alactic system of energy production. So ATP-PC system is predominantly used during maximum intensity activities which lasts for no longer than 10 seconds. Okay, so the intensity is going to be maximum, but the activity duration is going to be less than 10 seconds. That is when ATP-PC or the alactic system comes into picture. basically all the energy systems that we will be discussing is the duration and the intensity of the activities will determine as to which energy system will be predominant. Next is the anaerobic glycolysis or the lactic acid system. Here carbohydrates are stored in muscles as glycogen. So in this, ATP is produced quickly and no oxygen is required. That is why again it falls under anaerobic production of energy. But the difference over here is lactic acid is produced as an end product. Okay, in the previous system that we saw, it was alactic, so no lactic acid was produced at the end of the process. Whereas in case of anaerobic glycolysis, lactic acid is produced as an end product. So anaerobic glycolysis system, it is predominantly active when the activity is of high intensity and which will last for approximately 1 minute. Okay. So again, when the activity will last for less than 10 seconds, that is when the alactic system will come into picture. When the activity will last for approximately a minute or so, that is when anaerobic glycolysis will come into picture. So both of these systems are anaerobic. It will not require oxygen. Now coming to the third and the predominant energy producing system, that is the aerobic system. It uses carbohydrates in form of both glucose as well as glycogen as well as fats in order to replenish the ATP store. So O2 is required for this process, hence the name aerobic, and energy production will take a little longer but can continue for much longer duration. Okay, so in case of anaerobic systems, the energy production is rapid but it cannot sustain for a longer period of time. Whereas in case of aerobic, the energy production will not be as rapid as in case of anaerobic, but the activity can be sustained for a longer period of time. So as I said, depending on the activity that you're performing, the energy systems will come into picture. So high intensity, short duration, we have the anaerobic systems in play. And when it is, say, moderate to low intensity, but the activity is sustained for a long period of time, that is when the aerobic systems will take over. So all the three energy systems that we discussed, they work in synchrony. However, predominant energy system used to supply the ATP or replenish the ATP stores will depend on two things, as we just discussed, intensity and the duration. So if the intensity is high, it will be anaerobic energy systems. If the intensity is low to moderate, it will be the aerobic system. Similarly, when the activity is of high intensity and short duration, the main system will be anaerobic. Whereas if the intensity is of, say, low to moderate intensity and for a longer duration, the predominant system will be aerobic. So there is always an interchange between the aerobic and the anaerobic system, depending on what kind of activity is performed. So the anaerobic pathways are capable of regenerating ATP at high rates, but are limited by the amount of energy that can be released, okay, in a single bout of intense exercise. So that is why high intensity but short duration is always anaerobic, okay. So in contrast, the aerobic system can produce enormous capacity or enormous energy, but the only problem is the speed or it cannot happen quickly. So the delivery of energy will take some time. Okay, so that are the basic advantages and disadvantages of the aerobic and the anaerobic system. So this was about the energy systems. So we have seen two anaerobic and the one aerobic energy producing systems. Now let's look at some of the commonest principles of exercise training. So we have principle of overload, principle of specificity, principle of reversibility, and principle of maintenance. In case of principle of overload basically stress on an organism that is greater than that regularly encountered during the everyday life. Okay, so in order to improve the cardiovascular and muscular endurance, it is necessary that an overload is applied to these systems. Okay, so exercise load must always be above the training stimulus threshold for adaptation to occur. To explain it in very simple terms, unless and until you stress any system, okay, or you put any added stress on the system, you will not see improved functioning of that system. Okay, so that is why, as the first line says, it should be greater than the stress which is encountered in the everyday life. Okay, so you could be working on a specific muscle or you could be working on the cardiovascular system as a whole. unless and until you overload that muscle or you overload the cardiovascular system, you will not see desired improvement in these systems. So that is the basic meaning of overload. And by using the principle of overload, we are overcoming the effects of adaptation. Okay. So adaptation, it represents a variety of neurological, physical, and biochemical changes in the cardiovascular and the muscular system. So same amount of work can be performed after training, but at a lower physiological cost. Okay. So to again give you an example, suppose that you are going in for a, say what, 30 meters walk or 40 meters walk. So on the first day when you go in 30 meters, say maybe what, 1 kilometer, for example, 1 kilometer walk. So you go in for a 1 kilometer walk on say day one, okay, and you continue doing that for say 15 days, 20 days. So you will notice that the physiological cost for the same kind of intensity or same kind of distance has reduced over time. Okay, so you might get tired when you go for the first time, but when you do similar activity for 15 days, 20 days, you will notice that you are able to do it better at much less physiological cost. Okay, so this is happening only because your system is getting adapted to that specific training stimulus. Okay, so that is the meaning of adaptation. And as we discussed earlier, in order to further stress those systems, you need to overload. Okay, so overload is basically done to prevent the adaptation or whatever effects of adaptation have been obtained. In order to further increase your endurance or strength, you need to further overload that particular system. Either it could be cardiovascular system or musculoskeletal system. So overload and adaptation goes hand in hand. Next, coming to principle of specificity. So effects of exercise training are specific to the targeted parts and system of the body. Okay, so it is specific to the muscle groups that are used and energy systems that is utilized. So if you're training, for example, if you want to train somebody for say anaerobic sports, so shot put or weightlifting, which is going to involve high intensity, but the duration is going to be less. Okay, so when you train that individual, you will have to train so that the anaerobic systems are coming into picture. If you want to train somebody for marathon or swimming for longer laps, that is when you need to stress on the aerobic system. Okay, so it holds true for the systems as well. So anaerobic and aerobic. It also holds true if you want to train the individual for strength or if you want to train the individual for endurance. Okay, so depending on what specific goals you desire, you need to design your exercise therapy intervention in the similar direction. So that is the meaning of specificity. It could also help, say, for example, if you're training for a specific sport, you also need to train the individual by applying the principles of same sport. So if you are going to train for swimming, you will have to train the individual specifically for swimming. So that is the meaning of specificity. So it needs to be specific to the sport, it needs to be specific to the energy system, and it needs to be specific to the effect that you're trying to see, be it endurance, be it skeletal flexibility, or be it muscle strength, and so on. So this principle of specificity is also called as SAID's principle, that is a specific adaptation to imposed demands. So the next principle is principle of reversibility or detraining. So because of any reason, if an individual has to stop exercise or is confined to bed, all the effects that have been obtained with proper training will be lost, okay, eventually. So that is the meaning of reversibility or detraining. Now here again, it is seen that if you compare, say, a sedentary worker and an athlete, okay, who have been trained with at their specific intensities, the effects of detraining or reversibility will be more seen in an athlete as compared to sedentary work. Okay, so more effects gained are more effects lost. Okay, so athlete will have to face reversibility way harsher as compared to an sedentary worker. So deconditioning, for example, which can be seen in cases of prolonged bed rest because of many reasons. So there will be decrease in the muscle mass, muscle strength, cardiovascular function, total blood volume will be reduced, plasma volume, heart volume. There will be orthostatic intolerance seen, exercise intolerance seen, and the bone mineral density will also show a gradual decrease. So these are the effects of deconditioning. Now coming to maintenance. So the current level of fitness that an individual has achieved can be maintained by continuing the same amount of training or by slightly reducing training for brief period. Okay, so this will be true only when you are trying to maintain. Okay, if you are further interested in increasing the strength or increasing the endurance, you will have to work by the principle of overload. Only if you're trying to maintain or going for maintenance phase, that is when this principle will come into picture, wherein you can continue training with the same amount of load and the same amount of intensity. So these were some of the principles of exercise prescription. So we have seen overload, we have seen adaptation, specificity, reversibility, and detraining. So now let's discuss about the exercise program. So these are the determinants of an exercise program. So frequency, intensity, duration, mode, volume, and progression. So whenever you prescribe an aerobic exercise program, or for example, any strength-based program as well, it is necessary to describe the program under the headings of FIT. Okay, so FITT, it is also called as FITT. So frequency, intensity, time, and type. Along with that, the volume and progression of the exercise program also needs to be specified. So if all these headings are done properly, that means it is a very specific exercise program for that individual. So let's discuss it one by one. Coming to frequency. So the frequency of exercise will depend on the health or the age and the general condition of the individual. So the comorbidities or what is the purpose of exercise prescription will also help in determining the frequency. So optimal for aerobic exercise program, it is suggested that it should be 3 to 4 times a week. Okay. So for example, if an individual is deconditioned and you're just starting with the exercise program, then you will have to perform at the program at a lower intensity. So when the intensity is going to be low, you will have to increase the frequency. Suppose a patient is admitted in hospital wherein you cannot really increase the duration or say increase the intensity. So that is when you will have to increase the frequency. So you might have to see the patient twice a day or sometimes even thrice a day. And then gradually as the person's condition improves, you will come down to once a day. And that is how you will gradually go to 3 to 4 times a week. Okay, so frequency will depend on the health status of an individual and also the intensity that the person can be trained at. Okay, so even if these things are separate, like frequency is separate, intensity is separate, it will always affect each other. Okay, so you cannot have an exclusive frequency without even, without realizing or without understanding the intensity and the duration that the person can exercise at. Next, coming to intensity, as we have discussed initially, it will depend on principle of overload. So especially when you're looking at increasing the strength or increasing the endurance, that is when you need to work on the principle of overload. If it is just maintenance phase, then you can go by principle of maintenance and also principle of specificity. So it could be goal specific, it could be sport specific, and it could be system specific. So either aerobic or anaerobic, depending on what your goal is. So these are some of the things that you can use for determining the intensity of exercise program. So the most important is going to be HR max. So HR max, again, there are two things. There are two ways by which you can use HR max. First is the percentage of HR max. So say suppose 60% of HR max or 90% of HR max, or you can go by the heart rate reserve method, wherein you consider HR at rest plus 60 to 70% of HR max minus HR at rest. Okay, so HRR or the heart rate reserve method, I feel is slightly better than the direct percentage of HR max because it gives you wide range in which you can adjust your conditioning phase. So the individual will exercise for at least say 20 minutes in the heart rate reserve range in order to get the desired effects. Okay, so HR max, the ideal method of obtaining HR max is via maximal stress testing. The problem with 220 minus age that is routinely used is it is taking into consideration only the age of individual. Okay, so the gender is not taken into consideration. The physical activity level of two individuals, say an athlete and a sedentary worker of same age, will have same HR max if you go by 220 minus age. Okay, which in reality is not true. So at 220 minus age is not taken into consideration the physical activity level of the patient or the MET level of the patient or comorbidities of the patient, gender of the patient, all these things are not taken into consideration when you go by 220 minus age. So the ideal way of getting HR max is via the stress testing. So either Bruce protocol or modified Bruce protocol will yield you HR max. The gold standard of exercise prescription is again VO2 max, but again in our scenario, it might not be very feasible of using VO2 max for exercise prescription, but it is the gold standard of prescription, intensity prescription for aerobic exercise. So we have VO2 max, HR max, which can be used either as a percentage of HR max or heart rate reserve method. The next one is rate of perceived exertion. So this again can be used, like if we do not have the reports of say maximal stress testing, then RP can always be used, especially again for pulmonary rehabilitation patients, wherein it will be specific to that individual. So rather than going in for a generalized 220 minus age and using that HR max, RPE will be more specific to that particular patient. So RPE can be again used via either the box scale or modified box scale. So 6 to 20 scale or 0 to 10 scale can also be used for prescription of intensity. Metabolic equivalent or the MET value can also be utilized to prescribe intensity. And the least preferred one is the talk test. So this is just to give you some idea about the MET value of most common physical activity as to how the same activity can change from light to moderate to vigorous METs. So if someone is just walking slowly around home or office or whatever, that falls under light MET category. Moderate will be walking at very brisk pace, and vigorous will be jogging and running. Okay, so this can give you rough idea about the intensity prescription. Some of the activities that fall under light intensity is dart, fishing, most of the musical instruments, badminton when played as recreational activity, or golf or table tennis or volleyball. All these fall under moderate intensity, whereas bicycling, swimming, football and skiing fall under vigorous. So you can also use the MET value when you're talking about the intensity prescription. Okay, so these are the parameters that are most commonly used for intensity prescription. Next, coming to duration. So duration depends on the total work that is performed, exercise intensity and frequency, as well as the fitness level of the person. So as we discussed initially, if the individual is going to perform exercise at a high intensity or greater intensity, the duration will have to be shorter. If somebody cannot perform it at high intensity, or you say you want to target aerobic system, then you will have to go for low intensity and or moderate intensity. But the duration should last for at least 20 to 30 minutes minimum. Okay, so this is how you prescribe the duration. So if somebody cannot perform at higher intensity, you can perform at lower or moderate intensity, but increase the duration of the activity. So duration again, as you can start with 20 to 30 minutes and then gradually increase the duration for say 45 to 60 minutes. So it will have 5 to 10 minutes of cool down, 5 to 10 minutes of warm up, and the middle conditioning phase should be of 20 to 30 minutes. Next, coming to mode of exercise. So it should involve large muscle groups that are activated in rhythmic and aerobic nature. So again, the duration has to be high, and it will also depend on the principle of specificity. But if you want to prescribe it for a general conditioning program, then walking, cycling, jogging are good forms of exercise. We'll be discussing specifically about the 4 different types of aerobic exercises shortly. So high intensity interval training has it has emerged as a very important method of aerobic exercise prescription in populations with risk factors and even chronic diseases. So there are many studies which are looking at HIIT training even in the phase 1 of cardiac rehabilitation. So this exercise method is characterized by brief bouts of vigorous intensity exercise, which is interspersed with periods of rest or active recovery at a lighter intensities. So this was about frequency, intensity, time and type. Now let's come to volume. So volume is basically product of frequency, intensity and the duration of exercise. So it may be used for estimation of the gross energy expenditure. Okay. So MET minutes per week and kilocalorie expenditure per week are some of the standardized formats of energy expenditure. So to give you an example, if an individual exercises for 30 minutes for 5 days a week, okay, so at a moderate intensity, say suppose walking, brisk walking or so the MET value is 4 for that. So the energy expenditure of that individual will be, so 30 minutes into 5 days a week into exercising at 4 MET value. So that will give you 600 MET minutes per week. Okay. So this is how you specify the volume of aerobic exercises. So MET minutes per week and kilocalories per week are the standardized formats of energy expenditure. This becomes very standardized format, or it very uniform format when you're prescribing exercise program. Now coming to the next parameter, that is the rate of progression. So progression will always depend on the individual's fitness level, training responses, and the exercise program goals, as we just discussed. So progression is done by moderating components of frequency, intensity, time, and type of exercise as per the tolerance. Okay, so you have to moderate or alter or modify the FITT components in order to progress. Okay, so you can go from low intensity to moderate and high intensity. You can increase the frequency from say 2 days a week to 3 days a week to 5 days a week. Intensity again from low to high intensity. Time again, say from 20 to 30 minutes. Gradually it can progress to 30 to 45 minutes of exercise program.